One of the athletes I worked with this year was a young lady with radicular symptoms, and so we're going to talk about her. I'm going to review a little bit about dry needling first. I feel like a lot of us have heard about it by now, but I'll just review a little bit first. Then we'll talk about her case and how I integrated dry needling into our treatment. So dry needling is the use of solid needles, right? That's why it's called dry needling. We're not using hollow needles to inject anything into the tissue. The solid needles to create a lesion and ideally elicit an inflammatory response. Most indications that we use it for at this level are going to be like pain, scar tissue, range of motion. If you're working with an older population or just some really unfortunate athletes, you might have a little bit of osteoarthritis that you can use it for. The benefits of dry needling can occur at a few different levels, and so that you can see in this diagram, there can be local effects. So, you put the needle in the tissue, it's causing local microtrauma, it's causing mechanical stimulation. You might get a local twitch response, which is it can decrease the spontaneous electrical activity, is the SEA right there. You're also going to get a release of like vasodilators, inflammatory markers, so you'll get like the histamine, SP substance, the CGRP. That can also lead to angiogenesis and influx of satellite cells to replace any damaged tissue. And then at a more segmental level, and so that's one thing that's really cool about dry needling is it can work at a segmental level theoretically, and by basically the gate control theory. We have all heard the gate control theory. And then it can also work on a systemic level with what it does in the brain, with descending control pathways, like releasing basically your body's natural painkillers, so like opioids, dopamine, things like that. So this is my case. I had a 21-year-old, a senior cross-country girl who came in one day with leg pain, basically leg pain in her left leg. She's had it for about a week. She said it started radiating basically from her back into her posterior thigh, and then as the week progressed, it's radiated down to her foot, and now she's also feeling tingling and numbness in her foot. She doesn't have, her symptoms last anywhere from minutes to hours after exercise. Sometimes she's usually sore the rest of the day. She only feels pain when she's running. No other really daily activities really bother her. She doesn't have any history of significant injuries in her low back or her lower extremity, and she has been told, and I definitely told her, she runs with a very severe curve. So I can tell that she has a little bit of instability in her pelvis. And so I had her see the team doctor since she is having these radicular symptoms. She was having some mild tenderness with palpation along her paraspinals of her lumbar spine, very palpable tightness in her hips, her piriformis, a positive slump test on her left side, a 3+ patellar reflex on the left side, but she also had pretty normal range of motion. It was uncomfortable, but it was normal. And so our working diagnosis was back pain with lumbar radiculopathy. So this is a pretty typical treatment plan here that we use at Trinity. So our doctors usually recommend NSAIDs. We're going to do dynamic core stabilization. So she has a bunch of exercises that she starts doing, like dynamic warm-ups, as well as other just core stability exercises for rehab, working on her hip flexibility, especially in her posterior hip. She's allowed to continue activity as tolerated, and then we're going to get an MRI of her lumbar spine to check for, any disc injuries, severe back injuries that we might be missing. However, the athlete's insurance denied the MRI, of course, because they want 6 weeks of conservative treatment. So what in the heck am I supposed to do with her now, right? So we decided to do dry needling instead. So we started with, this is her first treatment. This was about 4 days post-eval, and so I used 4 3-inch needles. I put 1 in her piriformis and then 3 in her, that's supposed to be basically two black arrows, 2 black and 2 red arrows. 3 in her posterior hip to target her rotators. The red X indicates where I hooked it up to a TENS unit at 2 hertz with a wavelength of 80 for about 20 minutes. We didn't have any complications